It's not just radio, it's Rockland World Radio. RocklandWorldRadio.com.
Hello and welcome to Dialogues with Dan, and here's your host, Dan.
Thanks, Alex. Hi, everyone. This is Dan, and tonight we have a repeat live guest. I spoke with our guest tonight last on 8/9 of 2011. 8 is August 9th of 2011. I'm speaking with Nancy Rhodes, who is a nurse practitioner, and I'd like to welcome Nancy Rhodes. Hi, Nancy.
Hi, Dan. Thanks for having me tonight.
Oh, you're welcome. Great to see you again.
Same here.
You look great.
Thank you.
Like always. Maybe we could start by you sharing what a nurse practitioner is and what sort of things they do.
Okay. A nurse practitioner is a nurse first with a bachelor's degree, and then goes on and gets a master's degree in a field of nursing that she likes, or he likes: family, adult, acute care. It's pharmacology involvement. There's a lot of clinical rotations. It's a master's prepared program. It takes like 3 or 4 years to do that, and you need a certification, and you need to take a national test to become certified to prescribe and diagnose and treat common illnesses.
Yes, and what is your specialty?
Well, I was certified in family nurse practitioner in 1999, and I acclimated to geriatrics mostly, because now that I run a medical house calls company, that's who most of my patients are.
I see. Yeah, why would someone choose NP over traditional doctors?
Well, first of all, the world is changing in medicine, and a lot of doctors are not in internal medicine, general medicine, and nurse practitioners have come to the forefront in helping fill that void of caring for people who need general medical care and become the medical case managers for all their medical issues, not a specialty. So people find that nurse practitioners are easy to talk to. They're well educated, they are able to think out of the box, and they provide very good care with the least amount of expensive methods to keep people well.
And they're, I guess, not as stiff or professional. Like, no, yes, that's right, Mrs. That's right. That's right, Miss Rhodes, Mr. Winheim. I'll have to...
Just 1 second. Can we move your chair over here? Because we can't really, the camera can't see. Sorry.
What do you want me to do?
Just move this chair over here.
Oh, yes. Yes, we're having a little switcheroo. Dr. Alex is taking over. Oh, we're still rolling.
Okay.
Yeah, it's better close.
Yeah, you like that, okay?
Yeah.
Okay.
Yeah. So could you recap that about what sort of things you might do opposed to what you can't do?
There's not too many things I can't do. One thing, though, in New York State is I need to have a doctor who I collaborate with. And I think that, in general, all doctors and all clinicians collaborate. We talk with other people for ideas and other methods of taking care of people when it might be outside of our expertise. So I'm not sure I'm answering your question completely, but as a nurse practitioner, you can take care of all their medical problems, but sometimes it's more GI, and you need to speak to a gastroenterologist to say, what do you think of this, and what would you recommend, or there's an eye issue, or whatever. And most of my patients are over 90. Many of my patients are 90, 95, 100. I have two that are over 104 that don't require a lot of doctors to take care of them anymore. They don't need 7 specialists. They've already lived their lives and they want to be comfortable and they want to have peace to die at home.
Yes.
They would like to have no pain. They'd like to have their glasses fixed or maybe have a tooth pulled or have podiatry done. They don't need to have a lot of technical testing done and spend a lot of money
Yes.
for their care, and they're doing just great at home.
So you act as someone who, like, keeps them going steady.
Exactly. I see all my patients once a month. The first time I see them, usually the call comes in from a daughter. They're a baby boomer, like our age, 50s, 60s. They said, I have a mother and a father. They're in their 90s. Dad has dementia. Mom's been falling. They live together, but I'm worried about them being by themselves. They can't get out to the doctor anymore. They haven't had a physical in a year. They need to have blood work. They need to have a cardiogram. They need to have... So I will go in and do a full physical, talk to the daughter about the findings of the blood work. I will call someone to cut their hair. We will get someone to fix their glasses. And
Yes, I know.
all that.
You have a whole web of people, beauticians, podiatrists, and you said salon, and you have like a whole network of people that are part of your organization or
Right.
group.
But
So-
even more than that is if somebody has pneumonia or they fractured a rib or they have urinary tract infection, if I catch it early and the family calls me, they don't have to go to the emergency room. They can have an x-ray in their living room chair. We know that pneumonia is a left lower lobe pneumonia. I can prescribe on my computer medication to the pharmacist. I have a pharmacist that will deliver to their house. The nebulizer shows up and they get the Robitussin and they're better in a couple of weeks and they never set foot into the emergency room.
Yes. And how could people, like the internet, this goes to everyone in the world. How can, my program is heard all around. How can someone find a nurse practitioner?
If they need a nurse practitioner to make house calls, there actually is a website.
Oh,
I'm a member of the American Academy of Home Care Physicians, which is changing their name soon because it's not just physicians anymore. It's just to go to that site, American Academy of Home Care Physicians, and they can put their state in and their zip code, and they could find their general area who could come to their home because they can't get out for medical care.
wow. How great is that?
It is great.
And how is this paid for?
Insurance. I take Medicare, Medicaid, GHI, AARP. All the major insurances are covered. People pay me a copay like they would a doctor's office.
Yes.
Yeah.
Wow, so that makes things easier.
But there's more to it. It's keeping people in their own environment. It's letting them make their own decisions as to when they want to say, I don't want a lot of things done anymore. And then I do get involved with hospice, become the attending, and I sign death certificates in New York State as of January. So patients don't even have to land up in the emergency room. They don't have to get CPR if they don't want it.
Yes.
A do not resuscitate is put in their home, and everyone knows what to expect, and everyone's ready, and there's no crisis.
Yes.
It's great.
What about culpability?
As
Like,
far
have you had, problems where you do something and they say, oh, we didn't say that, and you're responsible. Has that come up?
Not really. I think one thing that I find, and you heard my phone ringing as we were coming online, people are calling me all the time, and there's a lot of communication, and we're solving problems. There's one thing I do is, and I think why my business is growing, is I'm available, accessible, I answer my phone, I solve problems, and they have constant communication with me, so we're constantly agreeing with what we're going to do together as
Yes.
partnership in the care of their parents.
Yes. And is there like a group, or is there, you have doctors group, and you have to
Mm-hmm.
get approval, and what do they call that?
Well, a group. Well, I will say that since I started my company almost 3 years ago, it's called Mobile Family Health Nurse Practitioner Care. I have hired 2 nurse practitioners to help me that work, fee for service, and I have 2 virtual secretaries. There's no need for an office building because we're all virtual or traveling around. So
Yes.
part of being an American is making American enterprise come to life. And my morning secretary from 9 to 1, my phone gets turned over to her, and everyone knows her daughter's on the floor laughing and singing, and they know she's home taking care of her children. And I employ her so she doesn't have to go out to work, and yet she can take care of her kids while she works for me.
So it all works.
It works. The lady in the afternoon takes care of her disabled husband who can't go out to work anymore, and she needs some income.
Yes.
And then you find there's one more thing, that I have patients who feel I had no purpose, so I'm finding them things to do. One of them is Miss Felicia, who is my sit-down comic. She loves to tell jokes, and I have many calls from my patients who are sad and lonely and just want to talk, and I have Felicia call them, and she tells them the joke of the day, and she calls them once a week, and they know how to find Felicia, and it's all free. It's just part of the community taking care of each other.
Yeah. It's excellent. People are so creative these days. It's unbelievable.
Definitely.
Yeah, so to do what you do, there's the required certification,
Mhm.
and you have that, and you can dispense medication
Mhm.
and write
Yes.
scripts.
Yes. I do dementia screening. I clean out people's ears because they can't hear. I do full physicals. I take care of diabetes. I do EKG testing, laboratory work, Coumadin monitoring. I take care of their high blood pressure medications. I solve urinary tract infections, cholesterol issues. I take care of ordering podiatry, eye doctor, dentistry, home care. Likes to go in and help out. Physical therapy, I give vaccines. I help evaluate the x-rays that I have done, ultrasounds. I had a man who had a clot in his leg, and he was 94 years old and bedridden, and we treated him at home, and he's doing very well without having to go to the hospital.
Oh, excellent. Yeah, Nancy, you live here in Rockland County, New York. Do you travel? Or, do you go to other states? Or what have you?
No, my patients are all in Rockland County, New York. I think that this is a possibility of expanding to every place in America. There are many, many people over 80 and 90, and the Medicare dollar is not going to stretch for all of us as we get older. And how are we going to be cost effective and give good quality care and do the right thing by our family members and take care of the caregivers who are growing old with their parents and working jobs and having their children move back in because they can't find jobs? It takes some ingenuity and it takes some imagination to figure out how do you solve this problem. We don't have to backpedal. A lot of what I'm doing is simple, good care, and it's saved a lot of money and a lot of aggravation for a lot of people.
Yes. But you did say this exists all around the world? Or
I don't know about around the world. I know that the American Academy of Home Care Physicians, there are a lot of people doing what I'm doing. I don't know if it's to the extent that I'm doing it, because I managed to find the hospital in the home. I managed to bring everything that people had to go out for to the home to keep them out of the hospital and to prevent catastrophe, short of surgery. I mean, we're not doing surgery at home and things, but we're making sure that as much as we can to reduce the stress on the family and the children and the caregivers is done at home. It
Yes.
makes it better for all of us, and it saves a lot of money for all of us
Yes.
in the future.
So maybe it's something that'll, definitely spread, catch on. And, I mean, financial crisis, the government, I mean, this maybe will make sense that it'll really
Absolutely.
take off.
I get calls, I get 8 or 9 new referrals a week now from everywhere. And people tell me the same story, the same story. I have a mother and she's 95 and she's 94 and my father's 98 and they're blind or they can't walk or they this or that, and what do we do now?
Yes.
And they just can't get to the doctor's office. It's very taxing for a family member to have to get an ambulette in the rain, get the coat on dad, and make sure he doesn't slip, and get him out there, and wait in the doctor's office for an hour, and then get a 15-minute appointment, and then go home. And yet, when I get to the home, they have an hour with me. Between setup and leaving, I've actually become like a family member. Many of my patients tell me that I'm like their other daughter, just because they see me in their own home every month.
But that's a good thing.
It's a wonderful
Even
thing.
They say you're like my daughter.
It's
But I like you. So
Well-
it's not exactly like my daughter.
Well, I think they
I'm joking.
feel, yeah, very funny. But the thing is that they feel safe
Yes.
and they trust me and they know that I will help solve a problem and I won't let them down. So patients love that when they're at this point in their lives, when they're so fragile. And the world is not an easy place when you're an old person.
Yes. So you're saying that this whole idea is really for older people, but do you see it in a younger person?
Absolutely. The reason why I called my company Family is that I felt that there are disabled children, with CP, and parents have difficulty getting them out. They get private duty nursing, but to get doctor care, or should I say medical care, they need to take them out in their wheelchair in the rain on the ambulette to a doctor's office. Who says this couldn't happen for all people who have difficulty and are homebound? Why not? Any age.
Yes.
So it could definitely involve the whole community of all ages.
Yeah. Maybe could you share some of your experiences? Maybe some of your better experiences and maybe not so great.
Well, I will tell you that every place I go, one thing that's important is it becomes a social visit for these patients. They see me coming and they're like, Nancy's here. We always have fun, even though they're sick. So there's always that piece of loving fun stuff. It doesn't have to be all tough. I do have one family of 3 women that are from Jamaica. One's 94, one's 96, and one's 98, and I love them. They wear Jamaican flower dresses and sandals with socks in the middle of winter, and they all have their lift chairs lined up in the living room, and they're all sisters. And there's something cooking on the stove every day, some kind of Jamaican food boiling away, and there's an extended family living there, and I love going to see them because I'll say, Elsie, time to come over here and sit in the chair, and she'll come over. It's her turn, and then it's Alice's turn, and then it's Nellie's turn. And I see them all once a month, and they're living. I've seen them for 3 years, and none of them been in the hospital.
That's-
It's been amazing.
It is. Wow. It's like a whole new outlook about medical care. I mean, you think, well, at least years ago, you think, doctor, oh, I don't want to go. Oh, a shot. Oh, I don't want to go. I don't want that.
Right.
Oh, I hate doctors. Don't do that. But this is like a happy occasion.
It is. It's a
Oh,
social.
Nancy's coming. The doctor.
They call me Nancy Nurse a lot.
Oh,
I
yeah.
hate that. No.
Oh, dude.
No, I think it's funny. My real name is Ann, though.
Yes.
For prescribing, it's Ann, but Nancy's my nickname, so people call me Nancy usually.
So
Yeah.
we'll call you Nancy.
Call me Nancy. Thanks.
No, of course. Yes, so what sort of not such great experiences have you come across?
Well,
Maybe billing wise?
Well, it's hard to get someone who's older who lives on a tight budget to even give you their $20 copay. That's true. But nurse practitioners get 85% of what the doctor gets. And yet I'm making a call in the rain, in the snow, and I'm schlepping my things into the homes. Something that doctors, or people will not do. It takes a lot of time. So for me to do that for 85% of what I could get, it's hard to really make a
Yes.
decent living. I could never afford to have a building, too. That's why I'm virtual.
Sure.
It makes it easy.
Yeah, I believe
It's hard.
we have someone calling up. I have someone calling from Michigan. I believe he'll be calling any second,
Okay.
hopefully. Yes.
And also, just to say, I got a call from a man from California yesterday who saw my website and said my parents live in Rockland County, and I'd like to know what you could do to help them from here. So having a website was important because a lot of children don't live in the area where I live and take care of people. They're trying to find help from the other part of the world or country, and having a website allows people to know who you are before you go out there.
Yes, most definitely. Yeah, also, what did you do before before taking on this work?
Okay, well, first I want to say that life experiences take you where you're supposed to be and not where you thought you were supposed to be. When I graduated as a nurse practitioner, Nyack Hospital nurses were going on strike. The day I got my last test done
Oh,
as an NP was the day after 18 years of working at Nyack Hospital. We all scattered to the wind because of a 6-month strike.
it's
And
a bad sign.
it was time, there was nothing, nobody knew what to do with me. As a matter of fact, I asked the hospital, what would you do with a nurse practitioner in house calls? And they said, we don't really know what to do with you. So as I went along on my own journey of working in doctor's offices, I found that there were a lot of my good things that I gave brought a lot of business in to offices, and I had a lot of great ideas. And I was not able to make a living because they were making a living from me. I
Yes.
thought after 3 or 4 offices it was time to take all my ideas and make it my own and hire people I want to be around and make it
Yes.
a fun, wonderful, exciting experience for people
Sure.
and it's hard work, but it's really fulfilling every day. I love it.
Excellent. Yeah, it
Yeah.
kind of sounds like that movie about the doctor, Robin Williams.
Oh, Patch Adams?
Yeah, right. A
I-
fun hospital.
Yeah, exactly.
Yeah.
I love that movie.
Yeah,
That was a
that
great
movie.
movie. Actually, I have a clown nose that I
Oh,
do carry
do you?
around. Except my patients don't really need that. They don't need to be
No?
laughing
No.
from that. But they love a good old joke for
Yes.
sure. And
You have your friend here who could tell a joke.
Mm-hmm.
good old or good young
Good young.
Felicia. Everyone loves Felicia. Yeah, maybe before my caller calls, I'll tell everyone about a book signing tomorrow, Wednesday, February 13th, from 2 to 3:30 p.m. My mother and myself, Dan and Marge Winheim, the authors of Opening the Door to a Brighter Future, we're doing a book signing at tomorrow's workplace at 1 Perlman Drive, Spring Valley, New York, 10977. There will be a book signing at tomorrow's workplace tomorrow from 2 to 3:30. And I hope anyone listening around Rockland County come and hear the program and pick up a book for a low cost of $10.
What's it about?
Oh, the book is the top 10 keys for bettering life after a disability or a traumatic experience. You know, how people can better their lives, either using their resources, the internet, newspapers, magazines, libraries, internet. That's one key. Another one is the relying on family and friends is also important. And then there's aiming high or low when setting goals. And there's also well, it's hard to remember, but
Getting good medical care with your disability is also, I know that's not in your book, but once there's a disability and it's hard to get around, you still need to have your heart looked at, and you still have to have your blood work done and things. Is that hard for people with disabilities to get their care? You find?
yes, it could be.
Mhm.
I mean, I guess it depends about your mobility is one aspect. Also, there's cognitive skills, actually reasoning and making lists and priorities. And not everyone can think on their toes and might not have friends or family that give them input. So it's important to rely on others for assistance.
So you have to have a good feeling of self after an event like that, or how to build your self-esteem and know that you're a worthwhile, supportive, and person in society that could give a lot,
Oh,
right?
most definitely. I think, most people either have something going on, either their self-esteem or their thinking isn't clear, and it's hard for them to focus or to prioritize.
Mm-hmm.
Yes, do you find that people out there are flying in the wind, that they're really not track there all over.
I think the whole situation in America now has got us all doing that. We're all trying to find our way financially and keeping jobs, and do we have pensions, and how are we getting our kids through college, and thinking of ways of enjoying what you're doing and making a decent living that gives purpose and also allows you to have a life, a decent life.
Sure. So what would you say to battle that difficulty
The difficulty of?
of needing to stay on track or focus or keep things, on target?
Well, first you have to have a good outlook that every day is a new day, a great blessing, and we're happy we're here. That you have to have the glass more than half full. That's big. And I think good karma comes to all that are putting that out there. So I've had wonderful, wonderful things happen to me. I had a patient who gave me $10,000 when I started my business and said, "I believe in you, and don't let the bastards get you down," he said. And he still doesn't want the money back. He keeps telling me to roll it over, and he has other ideas for me. And I think that's really like the pay it forward kind of thing.
Yes,
And
exactly.
that wouldn't have happened if I didn't have a good feeling of, good karma there.
Yes, so definitely remember that others are in a similar boat and that we're all in this together.
Yeah.
You know?
Oh, absolutely.
Yes.
And you have to be willing to help each other when people really need you, because it's going to come around for you too.
Yeah, exactly. Before we end, maybe you could share that website about nurse practitioners where anyone out there can, refer to that and maybe get assistance.
Okay.
What is that?
Well, it's called the American Academy of Home Care Physicians, and that's .com, and you would go on that,
Yes.
aahcp.com. But in addition, I'd like to tell my website, which is
Oh, please do.
www.mobile, FNP for familynursepractitioner.com. And my phone number, if anyone needs care in Rockland County, can call me at 845-608-7559 and speak to my secretary, Jen or Diane. I'd be glad to come out and help you if you find that you need medical care and you just can't get to that doctor anymore. And I will work with your doctor if he would like me to, or she, to keep you home and happy and have a
Yes.
great life.
Do you actually give referrals to other nurse practitioners? Maybe in other states?
Yeah, I have. Actually, I have, which is really neat because you meet them and you say, "I know exactly where I can get you help from when you moved away." And yes, I've had know of them in Long Island, and have
Yes.
referred patients,
So you
and
do
they've
have-
referred to me.
You do have contacts.
Oh yeah, you got a network. Network is big. It's a big world out there. The more people you know, the better for everything you're doing.
Oh, that's so awesome.
Yeah.
Yes, Nancy Rhodes, you gave us some great information.
Thank you.
Yeah, great.
Thanks for having me, Dan,
Oh,
on your
you're
show.
welcome.
It's great,
Excellent.
as always.
Yes.
And happy Valentine's Day.
Oh, thank you. Yes, so this has been Nancy Rhodes on Dialogues with Dan. Everyone, happy Valentine's Day. Get your sweetie a nice candy. Bye, everyone. Have a good night. Peace.
It's not just radio, it's Rockland World Radio. RocklandWorldRadio.com.